Hello, and thank you so much for tuning in today. I am really excited about this topic because it's actually quite challenging to find someone who is knowledgeable, at least on a deeper level, on MS and menopause. But I found someone, her name is Cherie Binns, and I am so excited for you to hear our discussion. Cherie was diagnosed with MS in 1994 after 19 years of symptoms. She was working as a home care case manager for a large visiting nurse service at the time. Because the only drug available to treat MS at the time was for early MS, she didn't have the opportunity for treatment until several years later. Although she was on disability for several years, treatment and lifestyle changes ultimately allowed her to return to the workforce. And as one of about 1,300 internationally certified MS nurses, she works for the MS Foundation as their patient healthcare liaison. She is also an advisor to the National Aging Initiative on their Older Adults with Multiple Chronic Comorbidities Council and is a peer and merit reviewer for several national research organizations. Cherie, thank you so much for being here with us today.
Well, thank you for inviting me.
Of course, I will say it's challenging to find someone qualified to talk on the topic of menopause and MS. I think it's such a niche, even though it's something so many people, MS or not, experience. So I'm really excited to dive into some of our questions today.
Did you know that 30% of the current MS population in the United States is perimenopausal or menopausal? 30%, not 30% of the women, 30% of the MS population.
Wow.
So this is a very timely topic.
Absolutely. So before we dive into those questions, is it okay if I ask you a question from my interview deck to help our listeners to get to know you a bit better?
Sure.
Okay, I'm going to shuffle. We have a new deck with us today. I recently went through all of the past decks, so you're our first question from this deck. Okay, your question is, what is the most important thing to carry with you all the time?
I think your sense of self-worth. Um,
Wow, what a great answer.
it's not a physical thing. You don't need a pocket for it. You don't need a purse to carry it in. You just need to know that you're worthy. You need to know that there's a reason for you being here and that you have value.
Wow. I don't think there's a better answer that exists. I love that. Thank you so much. Okay, so let's get into, I think, what could be the start of our conversation, kind of a broader question, but what role do hormones play in multiple sclerosis when it comes to symptoms, severity, you name it?
We used to write that off entirely as being hysterical, as being too somatic about something. Psychosomatic symptoms were often labeled. I mean, we were given that label of psychosomatic symptoms when our hormones changed the way we felt. Most of us who are of the female gender know what it's like to not feel well when it comes to be that time of month. Recently, I heard a statistic, I believe it was from the National MS Society's website, where they talked about in pediatric MS, they are actually seeing, as they're doing more research on the demographics, that girls that are being diagnosed ultimately prior to the age of majority are actually experiencing their first MS symptoms about 2.8 years after the onset of menarche or after their periods begin. That I know for myself, I've had MS now for the better part of 50 years. My first hospitalization with it was in 1975, but I started my periods at 11 years and 2 months. And my first symptoms of heat intolerance or foot drop or visual disturbances started by the time I was about 14.
Wow.
So that makes total sense to me when I see that because I've sort of lived that. many of us have experienced PMS, premenstrual syndrome, where we have bloating, we get crabby, we are more fatigued, our emotions are all over the place. And people with MS notice that some of those symptoms that are worse since they've been diagnosed with MS are also triggered and impacted negatively in that week prior to their period. They usually do really well in that couple of weeks after the period when the hormones are dipped down again. So we notice that. The one thing about menopause, that other end of the spectrum, is that historically, men have generally progressed in their MS disease progress at a rate about 25% faster than women do until perimenopause, until a woman's hormones start to dip down. And at that point, women tend to have more symptoms of their MS causing discomfort or causing a progression of some of their symptoms. Their foot drop might be worse, their spasticity might get worse. Certainly, the vasomotor symptoms like the hot flashes and the inability to really regulate their temperature can make some of your MS symptoms worse. The heat-related symptoms, for example, when you have a hot flash, your temperature can actually go up by a full degree just in that few seconds that it takes for the flash to live itself out. But that impact, I can certainly tell you, will last oftentimes for an hour or more. I found when I was going through that myself that I really couldn't do anything at work related to charting or related to reading research or anything like that because my vision was so distorted until my body got back to its baseline temperature. And this was in the days before cooling vests and all that kind of stuff. So, of course, you stand in the middle of the winter in front of an open window, fanning yourself to try to cool down to get the symptoms to calm down. So, yes, when a woman is fully through menopause now, we are seeing men and women paralleling each other in the degree of disease progression. So it's at that point in a woman's life she catches up with the men as far as the negative impact of MS on her system.
And one thing that you just said about the hot flashes is that it can cause your body temperature to go up by 1 degree. A lot of people might think that that doesn't sound like a lot, but when you have MS, 1 degree is a lot.
It's huge.
Yeah.
We can get Uthoff's syndrome or symptoms, which is a fancy name for heat-related worsening of symptoms, with just a quarter of a degree of temperature elevation. So, all right, maybe you've had a vaccine and now your body's beginning to develop a little response to that. I had somebody on our Facebook page the other day for the MS Foundation say, I just had my Pneumovax and yesterday, and today I'm feeling off. I feel off kilter. I feel off balance. I just don't feel right. And I had to say to her, this isn't because of MS, it's because you're developing a vaccine response, which is wonderful. Your body's doing exactly what it's supposed to do, so give yourself some grace. And it's the same thing with menopause. Our bodies are doing what they're supposed to be doing. And if we just understand what's happening, we can take those steps to sort of manage those symptoms by cooling, for example. And I do know that when I've been somewhat dehydrated, when I haven't been paying really good attention to my fluid intake, when I was going through that, for me, it was about a 6 or 7 year period, which is most women, you give or take 5 to 10 years to get through the whole process of starting to have that dip in hormone levels until you get to the point where you have been without a period for a full year. That is when menopause officially is diagnosed. Once you've not had any any menstrual activity for 1 year. Now, granted, we do have a fair number of us that have had a surgical menopause where we've had a hysterectomy. They're doing more and more hysterectomies without removing ovaries in women prior to the age of 55 or 60 when a hysterectomy is called for, if they can save the ovaries, only because we're beginning to understand the positive role that hormones play in cardiovascular protection. And again, in protection from things like a progression of MS. So I had a hysterectomy when I was 42, but they were able to save 1.5 ovaries, and still it took me about 7 years to get through the process. So, I think a lot of us may not even realize that we're going through that. We may attribute some of the worsening of our symptoms to worsening of MS. We may think our disease modifying therapy is not working, and that's not the case.
Yeah, that leads me to my next question, which is how do we know? I feel like if you're going through especially the early phases of perimenopause and maybe you don't know that that's what you are starting to embark on. A lot of people might think their MS is progressing because their symptoms are worsening. Is there a way to know or any guidance that you would give to help people understand, is it MS? Is it perimenopause or menopause or neither?
I, we consider a relapse with MS to be when your symptoms have been present without relief for 24 hours or longer. In other words, they're not relieved by rest. And they're also in the absence of an infection. A lot of us have urinary tract infections that we don't even know that we've got. Very, very common, particularly for women who've had vaginal deliveries. And, you know, I've had so many urinary tract infections over the last 40 years, I couldn't begin to tell you how many. And yet, there's only one of them that I can remember where I ever had any pain with voiding or where I ever had any visible blood in my urine. So I know that I've got a UTI when I get what I call emotional incontinence. I
Hmm.
cry at the drop of a hat, or I'll be sitting watching a cute kitten video, and I'll just start to tear up. And my husband now is so cute into that. He goes, you think maybe it's time for a urine culture? So, as we get to know our bodies, we know that sometimes things like that can impact our symptoms and make them worse. And once they're dealt with, things calm back down. So it's not the MS that's causing it, it's the underlying thing that's causing it. A couple of our medications might, if we're perimenopausal, might lead us to think that our MS is getting worse without realizing that we're menopausal. And those are the medications that have flushing as one of the side effects. So we've got a couple of oral medications for which a side effect is flushing within a few minutes after you've taken the medication. And it really is just like a hot flash. I mean,
Mm.
you get red in the face. I've had flushing so much on a couple of those medications that I was at work one day and they actually picked up the phone and called 911 because I was so reddish purple from
Oh,
it. And I
wow.
wasn't, and they could feel that I was just emanating heat. I caution women who are in their 40s or even their early 50s that if they're ready to make a medication change decision, that might be one medication they want to kind of put a little lower on the list just because it could aggravate those symptoms.
And which medication was that?
That would be Tecfidera or Vumerity.
Yep.
So those medications have the potential. Everybody doesn't get flushing with them, but for some women, it may aggravate those early hormonal changes enough that when they get that flush, it's also going to aggravate it, sort of compound the response. And they're going to think it's the medication, but it's really the hormonal change that's making it even worse. So that might be one trigger for somebody that is on one of those two medications, and they're having worse flushing than they'd had before. This may be an indication that their hormone levels are beginning to taper off.
Interesting.
And when that happens, we're now beginning to recognize that it does have a negative impact on MS symptoms. And it's time to have a conversation with your gynecologist or with your primary care doc, predominantly, because they actually know more about hormone replacement therapy than our neurologists do. So we want to kind of rely on our primary care to direct us in a lot of things that are not specifically neurological, or our gynecologist if we're seeing one. We're seeing more and more women being put on a hormone patch, which has both estrogen and progesterone in, two female hormones that tend to be minimized once that cycle of perimenopause starts. I was talking to a woman who is 52. She has primary progressive MS. And so her doctors were hesitant to put her on any disease modifying therapy other than Ocrevus, which is the only drug at the moment approved for primary progressive. And she'd had a doctor take her off medication because she was wheelchair bound, and he didn't feel that, given that, it made sense to stay on the medication long term. And so after talking to me, she went and talked to her primary care, and her primary care put her on patch. And she said, 2 months in, she said, "Oh my goodness, I cannot get over how much clearer my thinking process is.
Wow.
I can't get over how much less my fatigue is. I can't get over how my spasticity has begun to relax." She said, "Had I known this 5 years ago, I would have been on something then." So she says, I really thought when I heard you say hormone replacement therapy really helped women with MS to relieve their MS symptoms. I'm sitting in a wheelchair. I've got bed sores, and all of a sudden my life is turning around.
Wow, that's so amazing. So, if someone isn't sure if worsened symptoms is MS related or menopause or perimenopause related, it sounds like maybe a test to see if you have a UTI that you didn't realize that could be
Mm-hmm.
helpful. Are your symptom asking yourself if your symptoms are lasting longer than 24 hours without relief could also be a differentiating factor. What are your thoughts on getting hormone levels tested? I know that we can do that and see that via blood work.
Yep.
Is I mean, hormones fluctuate so much throughout our cycle anyways, but is there a time and place for that, or is that something that's not typically done?
No, there is a time and place for that. They're actually not always reliable because, again, we have fluctuations in our monthly cycles of where our hormones are. So you want to know what point in the cycle you're getting your blood work drawn, and your doctor can advise you on that. So track your cycles, track where you think you are. For me, my best indicator was I had, right from the time I was 11 or 12, I would feel ovulating on, and I would go back and forth each month. So one month it would be on the right side, and the other month it would be on the left side. And actually, when I got appendicitis, I thought I was ovulating, and
Oh
I thought it was
no.
a strange time of month to be ovulating. But some of us fortunately know that, and so if you are like clockwork in your cycle, it makes it easier for your doctor to target when would be the best time to draw your labs. So give them as much information as you can on that, and that'll help them to help you. Generally, though, particularly for women, say from mid 40s on, most of our doctors are going to try us on a low dose of some hormonal therapy without necessarily having the blood work to back it up, because we know that physiologically that's when most of us are on track to start that process. And I've heard women say that within 2 weeks of going on hormone replacement therapy, they're noticing the difference in their MS symptoms.
Wow.
They're sleeping better. With those vasomotor symptoms of the hot flashes, sleep is often interrupted to the point where you can have a hot flash so much that you soak the bed sheets.
Mm-hmm.
And so that means getting up and changing your nightgown and maybe putting a towel down over the damp sheets so that you can get back to sleep. So that further interrupts the sleep cycle. You have to wake up enough to do that.
Right.
And so our fatigue is worse because we're not sleeping as well. There are more interruptions in the sleep pattern. Oftentimes, when fatigue is worse, our spasticity ramps up more.
Mm-hmm.
Cognition decreases when our fatigue worsens. So it's kind of like this bundle of things that go together. So if we can manage those hormonal swings and just let them be tapers instead of swings, it minimizes the intensity of the symptom from the hormonal loss. So the intensity of the MS symptoms is also diminished.
Mm-hmm. So let's say someone understands that they are going through perimenopause or menopause and they've determined, yep, that is why my symptoms are worsening. Is that first step that hormone replacement therapy? And if so, is there anyone that wouldn't be appropriate for? Or is it just kind of a one size fits all? This is the best thing for you?
No, I would say if you have a family history of breast cancer, if you carry a gene for breast cancer, you're going to want to have that conversation with a gynecologist and not with your family doctor, probably not with your neurologist. You really need somebody that's more in tune with that risk factor. They're giving a low enough dose of hormone replacement therapy today compared to what we did 10 or 15 years ago that most women with that gene, even those women who have been treated for breast cancer and maybe had a mastectomy even, can safely take a lower dose of hormone therapy for a short period of time to get over the hump of those perimenopausal symptoms that are making their MS worse. Another thing that can really help women when they get into that place is to be very conscious about removing inflammatory foods from our diets.
Mm.
Sugar is the most inflammatory food in all of its refined forms, and it's in so many things. If you can eliminate refined sugars from your diet for a period of 1 month or longer, you're going to see some improvement in your MS symptoms, including in those hormone swings, including in the intensity of the hot flashes. But it's going to take a good month to get that out of your system before you really see the benefit of that as far as symptom reduction is concerned.
Mm-hmm.
But I would say if there's anybody that's not appropriate for, it might be a group of women who really are at very high risk for breast cancers or ovarian cancers because of a family history or a genetic propensity.
And for those people, is there something else that their doctor might put them on, or due to safety reasons, they just kind of let it happen?
If there's a really true, valid risk, they probably would not put them on anything else. There are, however, natural supplements like Mexican wild yam, for example, acts much like progesterone does. So, but it doesn't have that trigger that we know of for breast cancers.
Mm-hmm.
So, and you can get that in most health food stores. You can get it in online um, nutritional sites, but I never know the quality of them. That's the concern that I have.
Mm-hmm.
Soy, tofu, things like that actually act in much the same way. They'll give you almost a natural progesterone.
Oh, wow.
So if you're actually having hot flashes and you can't take hormone replacement therapy, not in large quantities, but certainly adding a little bit of soy to your food every day could help, whether it be a soy milk or whether it be some tofu, um, whatever. Something like that could minimize those symptoms. I'm not saying it will, but in some women it has.
That's really cool. I love little tips like that that are feasible for anyone. It
Mhm.
doesn't require, I mean, I guess it requires going to the grocery store, but other than that, it's available. Is there an age where we might stop hormone replacement therapy, or is it ongoing, especially if someone is noticing a lot of relief when using it?
We usually stop it by about the age of 65 because all of us will have naturally gone through menopause by that time. We'll taper it off. We don't stop it suddenly because you're going to go through that pseudo menopause again if you stop it suddenly.
Mm.
Um, and also, if we continue it longer than that age 65 or longer than 10 years, we do bump up our risk of cancers a little bit,
Mhm.
particularly reproductive cancers. So by 65, we're going to probably stop it. Again, we don't like to keep people on hormone replacement therapy for longer than about 7 to 10 years.
Gotcha.
So, also, one of the things that might relieve some anxiety on this about MS getting worse is that as we age, our immune system begins to slow down. It stops attacking itself with such vigor and such frequency or intensity. And so by the age generally of 55 to 60, all of our immune systems are naturally slowing down. And as our immune systems slow down, MS symptoms seem to lose some of the severity. We're seeing less and less disease activity on MRIs in people over the age of 50, which has led to a thinking that perhaps if you're stable over the age of 50 or 55 or 60, that you could safely come off of your disease modifying therapy.
Mhm.
Um, there's still, with people who've come off of their disease modifying therapy after that period of time and had new disease activity or a relapse, of course, we want to support that individual by putting them back on something that's effective. But that that age is only because historically that's when everybody's immune system starts to slow down. So we're not attacking our bodies as vigorously anymore. And
Mm.
we might be safe to get some of those products out of our system and let nature take its course naturally.
Right, right. And I know earlier you mentioned, I think it was Tecfidera and Vumerity specifically, but when it comes to DMTs and specifically B cell therapies, is there anything that we need to be on the lookout for? Does everything that we talk about still apply? Or do we need to have a further conversation with our either gynecologist or neurologist?
As far as menopause is concerned, I don't know that there is. The thing with the B cell therapies is that once somebody has been on them for a little over a year, usually it takes them a year and a half to 2 years to feel any different. But it takes a year and a half or so for them to really suppress our lymphocyte count enough, to suppress our B cells enough that we're not attacking ourselves anymore. Um, and so once somebody's been on those B cell therapies for 2 years or longer, we tend to not be elevating those B cells or lymphocyte counts between our doses, our every 6 month doses of the medication. So we might be able, as we get older, to begin to increase the length of time between infusions from 6 months to maybe 7, 8, 9 months to maybe even once a year for a
Mm.
while. Last year at the Consortium of MS Centers, they were telling us that they had a young woman who, prior to the time that we knew that Ocrevus is likely very safe to be taking during pregnancy and breastfeeding, she went off of her Ocrevus after being on it for about 2.5 years because she wanted to start a family. And she came off of it. She conceived. She had a normal vaginal delivery, nursed her baby for a year, got pregnant again, did the whole thing. And so she went back to her doctor about 3 years after she'd come off of her Ocrevus, and they took a look at her B cells that had repopulated fully, and they were non-reactive now. So,
Wow.
so one of the exciting thoughts that was brought out at the consortium last year is that this class of drugs, meaning Ocrevus, Rituxan, Briumvi, Kesimpta, could be a functional cure for MS. And so they're starting to do some trials, timed trials, where one arm of the trial that they were proposing would have somebody on Ocrevus for a year, then they would come off and they would look at their repopulating B cells. After only a year, they're going to repopulate fairly quickly. After 2 years, they're going to have another arm that they'll take people off, and then they'll keep another group of people on till maybe 5 years and take them off and look at it. And hopefully we can find the point of time where those B cells populate non-reactively and don't start attacking our bodies again.
Whoa.
So
That
this is so exciting.
that could be huge. I go to the annual MS consortium every year except last year because I had my baby in March. But that sounds like one of the lectures I definitely would have been at. So that is really exciting to hear.
That was actually one of the keynote talks on, I think it was day 2 or day 3. And
Wow.
it was really exciting to hear. And I thought I recognized your face.
Yeah. So, as a physical therapist, I also just have to ask, what role, if any, does exercise play for MS, but specifically as we're talking about perimenopausal, menopausal age? Does it play any role? Can it affect menopause or perimenopause in any way as it relates to MS?
It's funny. When I was diagnosed with MS, I was told rest.
Yeah.
And I hate the term deconditioned, but I got so deconditioned that even walking up a flight of stairs would have me short of breath and trembly and achy. Just making a point when I'm sitting at my desk paying bills to get up between each check written and walk the envelope to the mailbox and come back to my chair, not stay seated for more than 10 or 15 minutes at a time. I mean, as I'm sitting here at my desk talking to you, I'm walking under the table or under the desk. And I find that doing things like that improves my stamina. And as my stamina is improved, my fatigue goes down.
Mm.
My thoughts are clearer. I have less word retrieval problem. My spasticity actually is improved. My sleep is improved. And there are so many clinical trials on exercise and MS that have been completed in the last 5 to 10 years. And the evidence is overwhelmingly in favor of regular, consistent exercise for the individual with MS, regardless of their ability, even if they're wheelchair bound.
Mm.
So yeah, it's gonna help. It's gonna help the MS to be more manageable. As a result, if the MS is more manageable, and if it helps to manage some of the other comorbidities, then you may only have to struggle with the menopause changes. So it's like several things less to have to worry about. So your symptoms it just stands to reason that they're not going to be quite as severe during menopause if you're regularly getting that physical activity.
I like how you mentioned your activity because it makes it feel doable. You didn't say that you did 30-minute classes every day. You just make sure you didn't sit for more than 10 to 15 minutes. You're doing the stepper or bike under your desk. Like those are things that can be done throughout the day and you
Yep.
noticed improvement. So I love that
Yep.
mindset too.
Yeah, I for a period of time, probably an 8 or 9 year period, I had gotten a hot tub that was a floor model at the home show. And it was my cool water exercise place.
Ah.
So we built a room around it called our therapy room. So we've got a treadmill out there and yoga mats, and It's all bamboo flooring, and we've got the cool water hot tub, and I put in there are handrails that often come with hot tubs,
Mhm.
and I just took the cotter pin out of that so that they're movable, and I can set up my Pilates tubing in the handrails so that I can do stretches with legs or arms using the stirrup of the Pilates tubing.
Yeah.
Um, and for about 10 years, I did that. But then I got to the point where I was doing so much traveling for work. I couldn't really rationalize the $50 a month to run the electric to keep filtering the pool. And so I drained the pool in August of 2019, and I was on a plane like every 2 weeks.
Mm.
And then the
Nice.
pandemic hit,
Yeah.
and I just never refilled it. But I got into this routine of, you know, walking more. I if I've got something in town, I generally, if it's within a half mile, I don't even get in the car. I just walk.
Mm.
And most everything is downhill from my house, so I come back to it walking uphill. And yeah, I need to rest after that. I don't really need to rest after the downhill, but um, you know, I think we don't need to do that 30-minute every day, because the MS Society and the Consortium of MS Centers recommends a minimum of 30 minutes of activity every day. And that can be things like doing the laundry, or weeding the garden, or taking out the garbage, or walking the dog, or any number of things like that. And so if we purposefully move, if we say, looking at the time on my computer, I've been sitting here for 15 minutes. I need to get up and go get a glass of water. Or I need to go up and um, do some ironing for a few minutes. Or, whatever. Work it into what your tasks are and change tasks in the same way that people with MS change the muscle groups they're working on to avoid muscle fatigue. You change the tasks you're working on to increase your activity level and give you change throughout your day.
I
It's
love
going to
that.
lift your spirits. It's going to lift your energy levels. So,
Yeah, I feel like I need to start doing that right away as well. It's only up from here. So I guess my last question, or second to last question, is before we pressed record, you and I were just talking about research, and you had mentioned that there were two studies recently published on the topic of menopause and MS. Can you mention what those are and what we need to know about them?
I don't know the titles off the bat, but I just, before we got on this call, I went to the National MS Society's website, which is spelled out National MS Society. And if you type in the search bar MS and menopause, or menopause and MS, you'll come up with two recently published studies. One of them was just published in early February, and one at the end of January, on the impact of hormones and MS progression. And they're looking specifically at the role of perimenopause and menopause on the progression of MS symptoms, regardless of disease modifying therapy intervention. So those will help you. The other thing, that if you go to the MS Focus website, the Multiple Sclerosis Foundation, which is msfocus.org, that's the organization for whom I work as their patient healthcare liaison. I did the same thing when I went to our website, and it pulled up over 200 articles in our online magazine that on the impact of hormones of MS symptoms. Specifically related to MS, there are about 60. We also have a booklet that is free to be downloaded, or it's free to be mailed to individuals living with MS, and it's called Women and MS, and it looks at the impact of hormones on our MS symptoms across the age span, from the time a woman starts her periods until the time when they are no more.
Mhm.
So
Perfect.
those are all free resources for you to look for.
Awesome. Thank you. And for anyone listening, I will put those links in the show notes for you. That brings me back to a question, or not a question, but a thought I was having back in the beginning of our conversation, where you said, I believe it was 2.8 years
Uh-huh.
after we start our periods might be when people start noticing symptoms. And it's just so interesting because a lot of the time when I'm talking with patients, especially if they are a first time patient, I'll ask the question of when were you diagnosed? And also, when were your first symptoms? Because
Oh,
often those are
yeah.
different. But now I'm just thinking, gosh, had I known that statistic, I wish I would have asked a further question of when did you get your period? Because I wonder, oftentimes it was that their first symptom was like 20 or 30 years before their diagnosis. So now
Uh-huh.
I'm just thinking, I wonder when it started in relation to when they started their cycles.
But I think we also, with that thought, need to caution people that just because you're female and just because you are menstruating doesn't mean you're going to get MS.
True. Yeah.
Um, Only about 1 in 20 of you will.
Hmm.
So, I don't want to scare people with that, but I also want to empower women who are menstruating individuals that your menstrual cycle, the ebb and flow of different hormones working their way through your body, can impact your MS symptoms. And you can help that by staying well hydrated, by staying active, by getting refined sugars out of your diet, um, and by if you are in the age range of about 40 to or 45 to 55 and these symptoms are getting worse, then it's time to have a conversation with your primary or your gynecologist about hormone replacement therapy.
Is there anything else that we need to know about when it comes to MS and menopause or perimenopause that we haven't yet discussed?
Bone density diminishes with menopause as well. So you're going to increase your risk of hip fractures, particularly if you're not addressing balance issues. If you've got some gait disturbances and your balance is off, you really need to be making an appointment with a physical therapist for some intervention on that, tweaking your home exercise program, that sort of thing. I started fracturing bones at the age of 53. My doctor didn't start me on steroids, which was my first medication. We now know that steroids do not treat MS,
Hmm.
but he was a big believer in monthly pulse steroids at the time. And so, in a 28-month period, I had 38 grams of IV solumedrol, and 2 years later, I started breaking bones. And within a 2-year period of starting to break bones, I'd had over 70 fracture plates in my body. So I want to really
Jeez.
encourage women who are above the age of 40 to be very, very, very cautious about allowing steroids to be given. A lot of doctors will give them regardless. A lot of patients will request them because they like the oomph it sort of gives them.
Hmm.
But you're really setting yourself up to break teeth, to break bones, to lose teeth. And if you don't have dental insurance, that can be very expensive.
Right.
So I would say be very cautious about the bone density. Also, with that diminishing of your hormone levels, you're going to want to start getting DEX scans, which are bone density scans, every couple of years, just to kind of keep track of that if you've had steroids in the past.
Amazing. Again, so many great tips and things that we wouldn't normally think of. Well, this has been such an awesome discussion. I feel so empowered, and I feel like anyone listening not only will feel that empowerment, but also actual tangible things that we can start doing right away to help our symptoms, especially if we are around that perimenopause or menopause age. So, thank you so much for sharing all of your experience and expertise with us. I really appreciate it.
Oh, I'm happy to.